Kate Mason has worked in the welfare industry for over 20 years in the following sectors: disability, domestic violence, children, families, and youth. She also worked as a community development specialist. Her entire working and personal life has been focused on human rights, including the right to lead a dignified life, be treated with respect, and live free of discrimination. She's dedicated to communities where people have control over the course of their own lives. Welcome back, Kate.
Hi, Jason. Thanks for having me again.
Oh, it's lovely to have you again, Kate. It's crazy times, and you do not stop working on bringing forward awareness to a number of different issues concerning literally the globalist restructuring of human society. And every time we speak, you're able to bring forward a number of different issues that no one else seems to be wanting to cover, or in fact hasn't covered. Where have you been in the last sort of few weeks in terms of the development now of what's going on? What have you uncovered?
I've done a video on BlackRock because BlackRock was awarded the rights to, create the Southern Hemisphere's largest battery on the Central Coast, which is my local area. So I think it's really important to try to educate people about the global agenda when it's actually happening in your community. I think that's a better way, or it's a good way to go about it, because people are more naturally invested and might be a little bit more open to hearing some information. So I put some information out about that, and I did a talk on food. So I've been tracking the food technologies and putting that together. But I wanted to talk to you tonight about mental health and what I've had my eye on for a while with mental health. And I've just, putting some information together and some hypotheses I have as to the direction mental health is going to go in and how it's going to be used.
Excellent. These are obviously very, very crucial points, and even though we haven't planned or prepared this my next sort of introduction here, but this particular story that's come out of Queensland with these police being shot by this shootout with the Train family, we're learning, and certainly not through mainstream media, but through people who are reporting on social media who knew Nathaniel Train, the former school principal, that he was a man that was forced to take the vaccine for his job and had a heart attack shortly after. He was considered to be a terrific teacher amongst those parents that whose children were taught by him, and they're pointing to the fact that he never recovered from that perspective in terms of mental health. And I'm just wondering in all of this what your thoughts may be if you've even gone down this pathway. We're trying to find out and understand how it's possible that this thing has blown up the way that it has. And all we're finding is that we're getting more and more questions, and the finger pointing coming from the mainstream media trying to tar everyone with the same brush, that if you think outside of the square, you're automatically a bad conspiracy theorist. This is yet another one of these tricks that seems to be played on us. And the purpose of us discussing this is, firstly, one, not to be afraid of discussing it, but two, to show how rational heads prevail in all of this, and we can actually have a frank conversation about such a horrific story. Kate.
I've been watching the narrative being crafted for a while. I saw it, and I'll come back to what you're talking about, because I do have some thoughts about that. But in March, I saw, because we were raising concerns as welfare workers, that why are you doing these measures, these COVID measures on people? You're going, I mean, there were a few cases of people setting themselves on fire in Victoria. Like the mental health toll. And I don't even like the term mental health. I call it human suffering, because mental health leads to pathologizing, and it leads to symptoms, and it does not go to what are the causes of it, besides from a pharmaceutical solution or a mindfulness meditation solution. There's very few people that actually really unpack what a person's going through. It's all comes from the DSM, a manual that just says if a person's got 5 of these symptoms, then they have this diagnosis. So I've always been, never really thought along those lines. I've always thought more what's happening in somebody's life that's causing them so much distress. There's a very marked difference between mental health and thinking in the way I'm talking right now. So in March, we were raising concerns that the government and the lockdowns were causing human suffering. And why would they do that, particularly to children and young people? And, this long-term effect of that. So I saw in March, and I really noticed it because the WHO came out and said COVID-19 pandemic triggers 25% increase in prevalence of anxiety and depression worldwide. And this is the director of Department of Mental Health and Substance Use at the WHO. While the pandemic has generated interest in and concern for mental health, it's also revealed historical underinvestment in mental health services, and countries must act urgently to ensure that mental health support is available to all. So when I saw that, I was like, they're going to put more and more mental health services in that do not address why people are suffering, do not address the trauma people are really going through, because they can't. Because all the mental health workers that stood up against the vaccines were fired. So you're going to have a bunch of workers who completely go along with the agenda. So they're not going to say, well, of course you're feeling really distressed and disturbed because you've been under the biggest psychological operation, known to human beings over the last couple of years, which, they're not going to actually put it in context. So going back to what I've actually seen them crafting a narrative is that childhood trauma leads to people distrusting vaccines. So I've got newspaper articles that talk about it, reports that talk about it. So if you've had childhood trauma, you don't trust adults. And because of that childhood trauma and not trusting adults, you therefore don't trust experts, and you don't trust people who want to do the right thing by you. So if you are, and then they link, if you have a mental health disorder, which now huge amounts do of mental health disorders, I'll go through some stats that's on our government website, as well as what the World Economic Forum is saying about it. So if you then have a mental health disorder, you're more likely to look for conspiracy theories because you want certainty, and it helps with your anxiety, because now everyone's got anxiety. So it helps with your anxiety. So you're more vulnerable to conspiracy theories. And then they craft another narrative that if you believe in conspiracy theories, according to what they call a conspiracy theory, you are much more likely to become a right-wing extremist. And you can see that because of the way, as soon as people were protesting in Victoria on the streets, they were called right-wing extremists by the union and by mainstream media. So with what I picked up with this, what's the man's name? What's the teacher's name, the headmaster's name? The one that was...
Nathaniel Train.
Nathaniel. So on Tuesday night...
Nathaniel Train.
Yeah, this happened on Monday night, like by I think 9 or 10 p.m. they were shot. And then by Tuesday night, news.com.au, Tuesday evening or whatever, had this hugely long article where they'd researched a huge amount for 24 hours. And in it, they quoted a woman, Joanne Gray, an expert on digital cultures, said research suggested that people who have a distrust of institutions and were looking for someone to blame were more vulnerable to conspiracy theories. Conceivably, this person, talking about this headmaster, experienced some trauma. And that was the heart attack, she said. They were in a position where they faced institutional crisis and were looking for some kind of explanation. They became vulnerable and they were exposed to theories. So I've been seeing them craft it, and then it's in that newspaper article exactly, the narrative they're making around this.
Yeah, isn't that powerful, how you've been able to uncover all of that? Hold that thought, Kate. We're going to take news headlines and continue the conversation straight after you're on TNT Radio. And we're back with Kate Mason. And Kate, that is a really interesting big reveal there that's coming out of the globalist World Health Organization. I think the term I coined this week was that we are under a coup d'etat. It seems that these people, without any mandate, any sovereign connection to any of us, are simply taking over the way that the world is now run, with compliant or complicit, let's say, governments that are just handing over our sovereignty to become a medical colony of this private organisation, a subsidiary of the United Nations in all of it. I don't know how you keep a cool head in all of this, because you must be literally wanting to rip your hair out every time you dig down deeper, but the work you keep doing is exposing what's going on. But if we go back to all of this, so they're now trying to tell us that childhood trauma leads to mental illness. Mental illness leads to a susceptibility to conspiracy theories, and conspiracy theories lead to right-wing extremism. I wonder how that explains then how other people arrive at just a distrust of authority, and how it is that authority is never ever wrong except when it is wrong, Kate, because they seem to be wrong a lot, and then they just go to ground and cover their tracks.
Yeah. See, the thing is that there's, I mean, I know a doctor who spoke out against vaccines, or didn't speak, just raised concerns about vaccines, and then was hauled in front of a medical board, and then given a mental health diagnosis, and then stopped from working. So there's quite a few components to this that I can see. But one of the ways is you can silence people through giving them a mental health diagnosis. In 2001, the World Health Organization estimated that there were 450 million people worldwide have a mental health problem. So that was 7% of the population. And in 2022, it is now 12% of the population have a mental disorder. And they say, the UN says, the mental disorders include significant disturbances in thinking, emotional regulation, or behavior, and most of it is anxiety and depressive orders, and that because of the COVID-19 pandemic, that has risen exponentially, basically. So I went to, and then they put that to a cost of, because of people's poor mental health, it then costs the work life, it costs in people, it costs their health, it costs the government and the world a lot of money because of people's mental health issues. So I went onto the World Economic Forum. I've just found that they've got a strategic intelligence. It's a strategic intelligence interactive map, and so you can put in Australia, and then you can bounce around with all the ways that they're constructing narratives, because everything they're doing, it's not that there's not components of truth of what they say, it's the narrative they construct. And it's also that they don't look for the why people are now struggling and why they're suffering. There's no discussion on that. So I went in and had a really good look today at everything they're saying about mental health, because I imagine that that's where it's going to lead. So they say that, this is the World Economic Forum, the cost of mental health conditions is projected to rise to $6 trillion globally by 2030. And that's a rise from $2.5 trillion in 2010. And that's only just going to become worse because we're now sort of living in crisis capitalism. So there's always going to be more and more crises. But their solutions are genomics, the study and function and structure of genetic material. So they need to understand the relationship between genes and clinical traits. Scientists need to gain increasingly accurate descriptions of symptoms, treatment outcomes, physiology, and behavior. So this is then going to lead into where they start to track everything so they can predict a person's risk to disorders, I'm reading their language, to disorders such as schizophrenia and other conditions and addictions. So we have to be tracked. And then they can say whether or not we've got a precondition to getting a mental health diagnosis, which of course is then linked into that we need to be tracked and traced, which they then go on and talk about. Well, firstly, they also talk about AI, and that's how we can be helped through machine learning. So we can talk to apps, and apps can talk to us about our well-being and our health, and also to take our information and our data. So interventions can happen quickly and easily with us if we need it. And also doctors can know whether or not we're complying or not. So they've got it. This is their language. I'm putting things together, but it is completely 100% their language. So this is all the narrative they're structuring around mental health.
So interesting, Kate, because what they're also saying, therefore, that if you fit the definition of a conspiracy theorist, which broadly is anything that criticises the government at any point, they're now going to call that a mental condition itself, something that can be tracked, traced, and therefore reprogrammed through re-education, or in this case, it seems through the doctors using all of these new therapies, tests, chipping, etc., to reprogram through their genomics. It's just appearing before our eyes.
Yeah, so it's not, they don't have conspiracy theorists as a So there's a DSM. Everything's got to come from the DSM, and that came in 1952 with, I think it was 100 diagnoses, and now it's up to almost 300. I think that you can be diagnosed with. So they just grow every time they do it. But you can get thought disorders. So a thought disorder can be where you're being assessed for whether or not your thoughts are congruent, and there's a bunch of stuff there that I think maybe this could come under, where you're being assessed and your thoughts aren't rational, basically, depending on who's looking at you and what they think is rational. And of course, they think being a conspiracy theorist isn't rational. Well, that's what they call you anyway. So yeah, it's a bit of a catch-22, I believe. And I think we're just I'm just seeing the trends. I'm not seeing where it's all come together at this point in time. But they're also making big moves to link mental health with physical health. And of course, there's a component of truth to that. If you're really suffering, you probably physically aren't going to do well after a while. There's a truth to that, but they're going to link it with the same thing. So you have biometric sensors on you, and so when you go to your doctor or when you go to the hospital, you'll also be assessed for mental health. So they're going to bring mental health into every component of where you're being assessed. And I did look at the budget for for the Australian budget, if you just give me one sec for me to scroll down to where I got it, because I just don't want to talk off the top of my head about this, because it's all facts, it's all numbers and things. But the other point I want to also say is that this is from the Australian government website about mental health. 4.5 million people, 18% of Australians, filled a mental health related prescription in 2020 to 2021. So that's a huge amount of people have been put on antidepressants. And almost 1 in 7 children and adolescents aged 4 to 17 years have estimated to have experienced a mental illness in the previous 12 months. So, and then they also say to over 2 in 5, 44% of Australians aged 16 to 85 are estimated to have experienced a mental disorder at some time in their life. So we're not going into mental health used to be really serious, the serious end of things. Now it's just becoming a normal part of life that you have a mental health diagnosis at some point.
The numbers are staggering, absolutely staggering, and at no point does the government, the authorities, put any of the blame on themselves in any of this, the way that they are manipulating society to head down this pathway. It is one of these great anomalies. It's like looking at the climate change agenda for a comparison. We must do everything that they tell us to do. We must freeze ourselves in order to stop the world from heating up, all because we don't want the water levels to rise, caused by an average temperature increase that's immeasurable by just 1 degree around the world. All of these numbers are arbitrary. They say that they're not, and that they're all going to do something to save us all, or to stop us all from dying, or to save the planet and all of it. It's all grandiose, overblown, made up, kick the can down the road science. And we're seeing the numbers here in real time. It's the authorities, regardless of all their agendas and websites and global groups and think tanks. These are the people that have failed the population of the planet. It's not the people that are doing poorly, it's the authorities. Is there any way that we can track their performance in all of this and be able to show it? 44% of Australians 16 to 85 suffering a mental disorder somewhere in the lifetime is absolutely unacceptable.
And expected to grow. But do you know how easy it is to be diagnosed with depression? It's really easy for people to find out. You just look at the DSM, you just look it up, DSM-5, depressive disorder. You just have to go for 2 weeks and have some of the symptoms where you just depressed for 2 weeks, you feel unhappy for 2 weeks, most of the day, nearly every day. You aren't getting much pleasure out of any activity. You're fatigued, or you don't have much energy. You feel worthless, or you feel guilty. You can't think properly. So it's actually really easy to be diagnosed with depression. So it's not. So there's a book that I will come to, which is called Cracked, and it is by a psychotherapist and a lecturer. And he talks about the yardsticks moved from where a mental health disorder used to be because of something serious to where it's just become a pathologizing of people's fairly much emotional state, particularly when you put them under immense pressure like they have for the last few years. And it's it's a bit of a stitch up in my mind. It's a bit of a stitch up. And if you look at, so now it's with ADHD. So there's a new Australian ADHD guidelines has just been released. The taxpayers gave $1.5 million to the Australian ADHD Professionals Association to write the report. These guys have yearly conferences funded by pharmaceutical companies who make ADHD drugs. And their 2022 conference titled ADHD Coming of Age was sponsored by a gene sequencing corporation and 2 drug companies that make the drugs that are prescribed for ADHD. And the president and founder of this Australian ADHD Professionals Association who also was instrumental in writing the report, has received grants from a drug manufacturer that makes an ADHD drug and has given educational talks sponsored by another drug company. So this is what we're getting. We're getting organized. It's the same thing everywhere, isn't it, Jason? It's the same thing. We're just got the industry is co-opted by the pharmaceutical companies, and they're writing the guidelines and they're doing the studies. So what's going to end up happening? And in this report, they say, so I think it's 6 to 10% of children, the stats are given that 6 to 10% of children are affected by ADHD, and that once a child is diagnosed, everyone in the family should be assessed. As they state, it runs in families. And upon diagnosis, pharmaceuticals are the first line response. So you now have where they've got guidelines coming in to say, test more people. Get more people tested, and it's backed by pharmaceutical companies.
Gosh, it really is a brave new world in all of this. Get onto your Soma and you'll all be happy. It seems that it's just writing itself in real time. Going to pause for a break and come back with more analysis with Kate Mason. You are absolutely brilliant, Kate. Well done. Don't go anywhere. This is TNT Radio.
TNT Radio.
And we're back with Kate Mason. We are doing a deep dive here in limited time into how the World Economic Forum, United Nations, World Health Organization are setting up a narrative on mental health. And of course, it's the great growth area. And with that, that means a whole lot of resources, but it also means a directing of the narrative, the treatment, the understanding, and pushing everyone out of the way who doesn't go along to get along. Kate, it's always been sort of the last part of overall healthcare has been mental health. It's always been under-resourced and likely deliberately. But when you see a big proactive response like this and getting tested and the genetic part of it, you can't help feel that this is part of a much bigger approach to label, diagnose, like you said, rather than treat what's actually going on, right?
Yeah, absolutely. So the federal budget has $547 million over 5 years for mental health, and 9.7 million will be used in schools, including a national measure of student wellbeing, national guidelines for the accreditation of mental health and wellbeing programs, and trauma-informed professional development support for teachers. So they're going to train everyone to look at people in a certain way and look at children in a certain way. So they are going to bring these wellbeing monitoring into schools and more interventions in the schools. And they're also going to fund 1.8 million to fund a mental health literacy app. So it'll assist Australian parents and carers to identify the signs of social or emotional problems in their children. And then there's money to make a post-traumatic stress disorder centre, which is problematic when you see the correlation they're drawing between, early childhood trauma and the going then into conspiracy theories. The other thing, so there was $2.9 billion from the New South Wales state government to support mental health and wellbeing. And again, So there's a huge amount of being thrown as the WHO, as soon as the WHO says it, of course, then it's a global agenda. It's happening all around the world. In the USA, a leading panel of doctors has recommended all American children over the age of 8 to be screened for anxiety, even if they don't have any symptoms. And they also want children over the age of 12 to be screened for depression. So they're also asking for all adults between 18 to 65 receive a screening for both conditions. So if you're starting to screen screen everyone based on a set of criteria that's set by a global narrative as to what is healthy or not, I think we're in trouble. I think there's that component of it. I think that's very troubling when that's corporate captured, and then it's the corporates also that are involved in the pharmaceuticals, that are also involved with the United Nations and the World Economic Forum, that have a say in this crafting of this narrative. And as we saw just in the ADHD, it's an issue because, of course, more and more people are going to get diagnosed. There's no blood test you can do for any of this. It's arbitrary. It's arbitrary depending on who you go and see. It can be easily diagnosed. The other aspect is social impact bonds. And the World Economic Forum talks about social impact bonds. It's a fairly new, it's been in Australia since 2015 with a few programs. It's where corporates can invest in mental health programs, or they can invest in homelessness, they can invest in alcohol and other drug programs, in Indigenous, youth programs, whatever. And they get a percentage return. So we have one in New South Wales called New Pins, and the investors got 10% return, paid for by the government. So you've actually also got a market. You've got a market where people can be profited off. That is one way of seeing it. And the other thing is they try and make out that, so then it's also, what's the word, where you have to show that it's been successful. And when you put those sorts, I've worked in the sector, when you put those sorts of things, we have to show it's been successful. That's ticker box stuff, or it's a survey, or it then causes, it then influences the way people work with people. So it becomes less human. I guess this is the whole issue. It becomes less human-based, and it becomes about data. And it becomes about, so then you can, because of course, these non-government organisations that are getting money from corporates aren't going to want to lose that funding. So they're going to then have an extra pressure on them to get a certain result. Now, what falls down by the wayside can be just human connection, because in any good welfare worker or therapeutic, it's the relationship that's the most important thing. It's the trust and the long-term relationship. It's not about data, and it's not about did you tick this box, and did you how do you feel out of 1 to 10. That's not what it's about, but that's what right. It become like that, but it will become increasingly like that. And the other thing that's really important to note that is it's already happening in Victoria, there is a child information sharing scheme where children's well-being is assessed and put into data. And that can be shared. So the social worker can work out what they consider is a child's well-being. So they can say the parents seem to be fighting too much, or the child talks about their parents fighting too much. So the child's well-being is declining. So therefore, we need to get all these other services involved. They can share data across the services, and there's huge potential for something to go wrong there. You've got social workers that are like 22, 19, 20, probably 22, who probably are highly idealistic around what a natural, normal family goes, the ups and downs. You've got state intervention of family life and state enroachment of family life. I mean, it's so problematic. Yes. It used to be you could share data if there was a child was at risk of serious harm. So the benchmark again has changed from risk of serious harm, which is, complete neglect and abuse and sexual abuse. It's now changed to the child's well-being, where you can share and take and keep up data. So all I think we're going to see is more and more children becoming more and more co-opted by the state.
This is where we're at in all of this. It seems that the state wants to become the parents of the children in every way forward, that the family has now been or is being eroded in real time. And we're stuck in a situation now that, like you said, the risk of serious harm becoming about child's wellbeing, which is totally arbitrary and could be changed. I just want to go back, Kate, quickly in the last couple of minutes that we've got, this idea of new pins, which is a form of woke capitalism, the fact that the government is asking for investment and then paying way over the odds in terms of return on investment. This is an example that we've seen where governments and corporates will work together, itself fitting the definition of fascism and what would actually be a new world order government, which is corporate-run government entities. Government becomes the administrator, the corporation becomes the controller in all of it. It's happening before our very eyes. and paying 10% or over the odds on returns of investment is nothing more than a form of positive coercion to get these corporates to become woke, get involved, not knowing exactly what they're doing in all of it. It's absolutely disgraceful. Social impact bonds since 2015 here in Australia. Unbelievable, Kate.
And the World Economic Forum, talks about them being a wonderful thing and they need to grow. So I think that's what's going to happen. We're going to get corporates in more and more aspects of, if it was government funded, it's just, you got to answer to the government, in terms of how successful your program is, but it's become increasingly evidence-based, and evidence-based means, that's arbitrary as well. It's just like how you show your evidence, but it's not about they do not look at the level of work or the level of, it's just about how many kids, it's just tick box stuff. And
yes.
It's very dangerous, I think. I just wanted to I know we only got a couple of minutes, but I wanted to read out what the UNESCO Director General says about conspiracy theories.
Yes. Yep.
Conspiracy theories cause real harm to people, to their health, and also to their physical safety. They amplify and legitimize misconceptions about the pandemic and reinforce stereotypes which can fuel violence and violent extremist ideologies. And I think this is where we are heading, and this really worries me, this level of language and trying to paint people, as violent extremists if they start to raise questions. And I just also wanted to read this quote from, there's a really good book. And if anyone's interested in anything I'm talking about and wants to find a way through this system where they can get some good understanding of the system, there's a book called Cracked: Why Psychiatry is Doing More Harm Than Good, and it's by James Davies, and he's a psychotherapist and a senior lecturer in social anthropology and psychology at the University of Roehampton, London, and he puts forward a hypothesis that by progressively lowering the bar from what counts as mental disorder has recast many natural responses to the problems of living as mental disorders requiring psychiatric treatments. In other words, has psychiatry, by redrawing the line between disorder and normality, actually created the illusion of a pandemic? And I would recommend or just say to people, just have a read. I'm not saying that people, there's no place for it. There is, if people are in serious trouble, but there's a lot that's gone on, and there's a lot of documented stuff around what's gone on in the mental health field. It's not just 100% accurate. There's a lot of different opinions about it. It's often just, even the diagnoses are often just people standing around arguing for a few hours to decide on the parameters of a diagnosis, and that's all documented.
Absolutely. Well said, Kate. Unfortunately, we've run out of time. It's been wonderful to have you on the program, not just today, but all year. I wish you a Merry Christmas and thank you so much for your contribution. It's truly amazing. Well done. News next on TNT Radio.